Hello guys, welcome back to Medico Days. So today I've come up with the next subject of the rapid revision series, and the subject of today is medicine, and I've compiled the questions from 2018 to 2023 in this session. So moving on to the first question, identify the condition associated with the murmur depicted in the image below. So here you can see a pansystolic murmur, and it is seen in mitral regurgitation. So murmurs is a very important topic, different types of murmurs in different conditions. You need to have an idea. Next question, a young man presented with early morning backaches, stiffness and red eyes. X-ray shows sacroiliac joint erosion. What is the diagnosis? Answer is ankylosing spondylitis. It is associated with HLA B27. Next one, a patient with hyperkalemia and elevated urea levels develop drowsiness and seizures after dialysis. What is the treatment? Answer is IV mannitol. Next question, a female with bronchial asthma presents with restlessness, palpitations, tremors and atrial fibrillation. What is the immediate management? Answer is diltiazem. The patient has thyroid storm with atrial fibrillation, and diltiazem is used for rate control in atrial fibrillation. Next question, a 30-year-old male with chronic hepatitis, HBsAg and HBAg positive, high viral load and elevated SGPT levels requires treatment. What is the appropriate treatment? Answer is tenofovir for more than 40 weeks. Next question, a 25-year-old male with palpitations, sweating and sweaty palms has elevated thyroid receptor antibodies. What is the diagnosis? Answer is thyroid receptor antibody. Now next question, an HIV patient presents with violaceous growth on the head palate. What is the diagnosis? So answer to this is Kaposi sarcoma, where there is violaceous growth in the oral cavity. Next question, a patient with difficulty expressing emotions, resting tremors and rigidity has involvement of which area of the brain? Answer is basal ganglia. Next one, an HIV positive male with persistent cough, weight loss and umbilicated papules has? Answer is HIV with disseminated histoplasmosis. Next question, a patient with seizures, fever, headache and bitemporal lobe inflammation on MRI has? Answer is herpes simplex virus infection, that is HSV encephalitis. So all these are PYTs and they are very important topics. So you need to read in depth about the PYTs. Next question, a patient with sensory loss, angular stomatitis and absent ankle reflexes has? Answer is, among the options provided, the most appropriate answer is subacute combined degeneration of the cord, which is seen in vitamin B12 deficiency. Next question, a 40-year-old female with chest pain, mid-diastolic murmur and prominent A wave on JVP has? Answer is tricuspid stenosis. So JVP again is an important topic. Go through that. And next one, a hypertensive patient on multiple medications presents with tall T waves. Tall T waves is very important, always seen in hyperkalemia, and hyperkalemia is caused because of certain drugs like spironolactone. Next question, a 78-year-old woman with visual hallucinations, convulsions and Lewy bodies on pathology has? Answer is Parkinson's disease. It is also seen in Lewy body dementia, but here that option is not there. So the second most appropriate answer is Parkinson's. Next question, a patient with polyuria, sodium 155 and urine osmolality of 200 after hypophysectomy requires? Answer is DDAVP supplementation for lifelong. Next question, a 65-year-old smoker with upper chest discomfort, ptosis and tinkling in the 4th and 5th digit has? So this is again an important question, Pancoast tumor, and it is seen in Horner syndrome. It was a bouncer question. Such related questions usually didn't come previously, but you need to be having an idea about the medical conditions and certain conditions like Horner syndrome now onwards, because there's a chance of questions coming up. And PYQs, you cannot miss out all of these questions. You need to be knowing the answers in tip top in your fingertips, and the PYTs you need to have go through it in depth. Next one, a chronic alcoholic with acute pain and swelling of the grade 2, normal serum uric acid and raised synovial fluid leukocytes likely has? Answer is acute gout, because acute gout presents with normal serum uric acid levels during an acute attack, and synovial fluid analysis shows monosodium urate crystals. Moving on to NEET PG 2022, a patient with diabetes mellitus for past 5 years presents with vomiting and abdominal pain, and she is non-compliant with medication and appears dehydrated. Investigations revealed the blood sugar value of 500 mg per deciliter and the presence of ketone bodies. What is the next step in management? Answer is IV fluids with regular insulin. So diabetic ketoacidosis, again that regimen, that chart of diabetic ketoacidosis management is very important. Next question, CSF specimen of a patient shows mononuclear cytosis, elevated proteins and low sugars. What is the likely etiology? Answer is tubercular meningitis. Again, a chart of bacterial meningitis, tubercular meningitis, viral meningitis. This is also very important, guys. You need to have an idea about that. And next one, a retropositive patient started on HERT. Which parameter monitors treatment efficacy? Answer is viral load, that is the HIV RNA levels. Next question, a female patient presents with unilateral headache, nausea, photophobia and phonophobia. So this points towards migraine. And what is the drug of choice in migraine? Answer is sumatriptan, which is 5-HT1B1D agonist. This 5-HT1B1D agonist is also something very important. Next, a hypertensive non-compliant patient presents with sudden breathlessness. Chest X-ray shows pulmonary edema. What is the management? Answer is IV nitroglycerin, because it reduces the preload in cardiogenic pulmonary edema. Next question, patient on antidepressants presents with hypotension and ECG shows wide QRS complexes. Management is, so answer is IV sodium bicarbonate, because IV sodium bicarbonate counters the sodium channel blockade in tricyclic antidepressant toxicity. Here, since the patient is on antidepressants, most likely it would be tricyclic antidepressant, because that is the one leading to wide QRS complexes with hypotension. Next question, a patient with fever, night sweats, ptosis, bilateral facial palsy and hilar lymphadenopathy. What is the diagnosis? So all this points towards sarcoidosis. It presents with granulomatous inflammation, bilateral hilar lymphadenopathy and cranial nerve involvement. Next question, a 35-year-old female with fever, cough and CT shows consolidation with air bronchogram. What is the diagnosis? So answer is consolidation with air bronchogram. As mentioned in the question itself, it has come up. So consolidations are seen in lobar pneumonia, and there will be air bronchogram seen on radiological imaging. Next question, which condition does not require endocarditis prophylaxis during tooth extraction? Answer is ASD. Next one, a patient ingested 10 paracetamol tablets leading to oliguria and deranged LFTs. What is the management? So the antidote for paracetamol poisoning is N-acetylcysteine, which replenishes the glutathione levels. Next, a female with calicturia and a pituitary tumor, best drug if surgery is declined is, answer is bromocriptine, which is a dopamine agonist. Question number 12. A patient with irregular pulse of 120 per minute and pulse deficit. What is the JVP finding? So this irregular pulse is seen in atrial fibrillation, and in atrial fibrillation there be absent A wave. Next question. A cirrhotic patient with ascites, neutrophil count of more than 650 per mm cube. What is the diagnosis? Answer is spontaneous bacterial peritonitis, because the neutrophil count is very high in the ascitic fluid. Next one, jaundice with elevated bilirubin and ALP and normal liver enzymes. What is the diagnosis? So answer to this is obstructive jaundice. Again, the values of bilirubin, ALP and liver enzymes in different types of jaundice, you need to have an idea. Question number 15, a woman with fever, arthralgia, ulcers, hematuria and RBC cas. What is the diagnosis? Answer is lupus nephritis, because all these are features seen in SLE. Question number 16. A 11-year-old girl with acute rheumatic fever. Benzathine penicillin prophylaxis regimen is, answer is for every 3 weeks for 5 years or until age of 18. Question number 17. A woman on diuretics with ECG shows flat T waves and U waves. What is the diagnosis? Answer is hypokalemia. Next question, ABG shows pH of 7.2, PCO2 of 81 and bicarbonate of 40. What is the diagnosis? So again, acid-base disorders, very important. How to calculate respiratory acidosis or metabolic alkalosis or all of these is something important. Here in this, this is a question, answer to this is respiratory acidosis here, which is not seen in MEN2B syndrome. MEN1 syndrome, MEN2 syndrome are very, very important. MEN2A, 2B again are very, very important. So parathyroid adenoma is not seen in MEN2B syndrome. Next question, a CAD patient with chest pain and ECG shows ventricular tachycardia. What is the management? For management of stable ventricular tachycardia, we give IV amiodarone. Question number 21. MDR-TB is resistant to which drugs? So multi-drug resistant TB is resistant to isoniazid and rifampicin. You need to also know what is XDR-TB and the regimens used there as well. So go check out on that. Next question, HBsAg positive and IgM anti-HBC positive and anti-HBs negative. What is the diagnosis? Again, the chart of hepatitis condition, whether it is acute or subacute or chronic, or this is something very important. Please go through that table as well. So here it is acute hepatitis B. Question number 23. A child with iron tablet ingestion and acidosis presence. What is the management? Answer is deferoxamine, because deferoxamine is used in iron toxicity. Moving on to NEET PG 2021 question and answers. Question number 1. A 37-year-old woman presents with headache for 6 months. She has been taking analgesics regularly. Headache recently increased in severity for 3 days but reduced on stopping the analgesic. So diagnosis is medication overuse, headache, and the diagnostic criteria for medication overuse headache is also provided here, guys. Next, question number 2. A 20-year-old woman presents with breathlessness and chest pain. She is a non-case of mitral stenosis. Her pulse is irregular and no thrombosis seen on ECG. No thrombosis seen on echo. What is the best agent to prevent future thrombotic events? Answer is oral warfarin. So anticoagulants used in atrial fibrillation, vitamin K antagonist can be used, which is warfarin, and antithrombin inhibitor can be used, and factor Xa inhibitor can also be used. Next question. Evaluation of a patient revealed the presence of a mid-diastolic murmur. JVP showed prominent A wave. So it is seen in tricuspid stenosis. JVP again very important, and murmurs also very important. Repeated questions. And next, question number 4. A chronic alcoholic male patient presented with abdominal distension, reduced urine output, and pedalelema. Serum creatinine level is 1.6, which is high. What is the next line of management? Answer is octreotide plus albumin, because it is a question of hepatorenal syndrome. Next question. A 68-year-old man presents with cough and yellowish sputum. Auscultation revealed bronchial breath sounds. He is hemodynamically stable and not confused. Respiratory rate is 20. BP is 110/70 and urea is 44. What is the next best step in management? Answer is consider admission in a non-ICU setting. And the CURB 65 criteria again is very important. And recently they have removed the urea levels from this, but still it is very important, guys. CURB 65, you need to know that. Now question number 6. A 30-year-old man presents with excessive fatigability towards the end of the day that improved with rest. He also has ptosis and difficulty in speech and swallowing. What is the diagnosis? Answer is myasthenia gravis. Again, a very important question from pharmacology and from medicine level as well. Question number 7. Woman with hysteria who was hyperventilating developed carpopedal spasm. What is the likely cause? Answer is respiratory alkalosis. Next, question number 8. A 10-year-old child present with recurrent pulmonary infections and bulky greasy stools. And quantitative estimation of the stool fat was more than 10 gram per day. What is seen in this child? Answer is distal intestinal obstruction. Next, question number 9. A 36-year-old woman presented with claudication in the forearm, transient loss of vision and abdominal pain. Femoral pulses are weak. Fundus examination showed retinal hemorrhages. What is the diagnosis? Answer is Takayasu arthritis. Next, question number 10. Again, this blood-related diseases are very important, guys. Aorta and large vessel, small vessel diseases are also very important. And moving on to question number 10. A diabetic woman is admitted with vomiting. She consumed food from outside and BP is 90/60. ABG shows pH of 7.52. Bicarbonate level is 30. PaCO2 is 20. Sodium is 123. Potassium is 3.2 and chloride is 67. What is the cause of her ABG findings? Answer is persistent vomiting, because you need to know which condition will cause hagma and which condition will cause nagma. There's a table again available for this, and please learn in which all conditions hagma and nagma are seen. Next question. Question number 11. A woman presents with fever, nocturnal cough, breathlessness and wheezing for 4 weeks. Absolute eosinophil count is more than 5,000. Chest X-ray shows miliary pattern. Diagnosis is tropical pulmonary eosinophilia. Miliary pattern is also seen in TB, but here the eosinophil count is also very much high, so there's a high chance of tropical pulmonary eosinophilia becoming an answer, and it is treated with diethyl carbamazine, that is DEC. Next, question number 12. A middle-aged man with chronic renal failure on dialysis presented with sudden collapse and labored breathing. ECG shows tall tended T waves. So tall tended T waves. And what is the most likely acid-base imbalance here? So the answer should be pH is 7.14 and PCO2 is 20 and bicarb of 5, because it is common. Metabolic acidosis is common in CKD patient. Here the patient is having chronic renal failure as mentioned in the question. Next, question number 13. A woman presents with numbness of her fingertips and tightened facial skin. ANA is positive with nucleolar pattern. What is the diagnosis? Answer is systemic sclerosis or scleroderma. Question number 14. A 45-year-old woman presents with hypertension and loss of consciousness, chest pain and diaphoresis. Bilateral pulses are unequal. ECG shows non-specific ST T wave changes. What is the next best investigation? Answer is transesophageal echocardiography, because it is the investigation of choice in unstable patients in cases of aortic dissection. So aortic dissection again is a very important topic, and the management is important. Next, question number 15. A 10-year-old child with AIDS presented with fever, productive cough, and right lower lobe consolidation on chest x-ray. CD4 count was 55 cells. What is the most common causative organism? So at different levels of CD4, when CD4 is less than 200, when CD4 is less than 500, when it is less than 50, all different types of organisms will be the ones colonizing. So you need to know about the CD4 levels and the organisms at each levels. So here the answer would be Streptococcus pneumoniae. Next, question number 16. A patient presents with seizure. Urine osmolarity is 1000 and serum osmolarity is 270. Which electrolyte abnormality is expected? Answer is hyponatremia. Next question. A male child has feeble femoral pulses with upper limb BP of 186/90. Chest x-ray shows enlarged intercostal arteries. What is the diagnosis? Answer is coarctation of aorta. Next, question number 18. A patient with atherosclerosis underwent circumflex artery bypass and stent placement. He is already taking lisinopril, verapamil and metoprolol. Which drug should be added? Answer is P2Y12 inhibitor receptor blocker. That is clopidogrel is the commonly used one. Next, question number 19. Which statement is incorrect regarding pheochromocytoma? Answer is propranolol is given initially to manage the hypertension. That is wrong, because pheochromocytoma management is also very important. Recently questions are being coming up from pheochromocytoma about how it presents and about its treatment and things. So please go through that as well. And next, question number 20. A patient with giant cell arteritis, again the medium large size blood vessel disorders are very important. All the blood vessel disorders are important. Go through that. So giant cell arteritis, first line management is steroids. Question number 21. A 50-year-old man presents with recurrent retrosternal chest pain lasting 3 to 5 minutes, relieved by sublingual nitrate. ECG shows left ventricular hypertrophy and flat T waves. He also has hypertension, diabetes and hypercholesterolemia. What is the next step in management? Answer is injection enoxaparin, because in this condition there is non-ST segment elevation, MI, acute coronary syndrome. So enoxaparin is the first line management here. Moving on to NEET PG 2020 questions. A patient presents with lethargy, increased sleep and weight gain. Investigation shows low plasma TSH, but TSH levels increase after TRH administration. What is the likely condition? So since TSH is increasing after TRH administration, it is because of disease in hypothalamus. Next, what is the child Turcotte Puig classification for a patient with bilirubin of 2.5, albumin of 3, INR of 2 and no encephalopathy and mild ascites? Again, you need to know about these 5 parameters which are included under the child Turcotte Puig scoring, and you need to calculate what is the total score and then classify it under class A, B, C. And here in this the total score is 9, so it becomes in class 9. Again, a very important table and a very important question. Questions keep repeating, and previously a lot of questions used to come, but you never know. Sometimes since it's a PYT, it's an important area. Go through it. Sometimes question can come up in NEET PG 2025. Next, an elderly woman presents with behavioral changes, multiple falls, urinary incontinence and dementia. What is the diagnosis? So answer is normal pressure hydrocephalus, because this is the classical triad of NPH, gait abnormality, urinary incontinence and dementia. Next question. A 60-year-old male with COPD presents with acute exacerbation. Initial management is non-invasive positive pressure ventilation. Next, thrombocytopenia, eczema and recurrent infections are seen in Wiskott-Aldrich syndrome. Again, it's an X-linked disorder, and the common features seen in Wiskott-Aldrich is thrombocytopenia, eczema and recurrent infections. It's a triad. Next, what is the more common in limited cutaneous systemic sclerosis compared to diffuse cutaneous systemic sclerosis? So again, the differences are there. You need to know. And esophageal dysmotility is one more common in limited cutaneous systemic sclerosis, and limited cutaneous systemic sclerosis associated with CREST syndrome, which CREST. Each of these have their own elaborations. So please go through that. It's a homework. What is the elaboration of CREST? So just like esophageal motility, which comes for E, there is also elaborations for the other letters as well. Next one, Waterhammer pulse is seen in? Answer, aortic regurgitation. Different types of pulse and different names. Waterhammer pulse is also known as Corrigan's pulse, seen in aortic regurgitation. And aortic regurgitation has a lot of other signs which are seen, like Hill signs and many other signs which are seen. So please go through them as well. Sometimes a question can come from there. And ABG findings of pH of 7.3, bicarbonate of 10, PCO2 of 30. What is the secondary disorder? Answer is hypoventilation causing decreased CO2 washout, because here ABG shows metabolic acidosis with inadequate respiratory compensation, leading which indicates that secondary respiratory acidosis because of hypoventilation being the answer. Next one, what is seen in pituitary apoplexy? Answer is pituitary apoplexy can lead to adrenal insufficiency, and so it can finally lead to shock and hypotension. Next question number 10. A 20-year-old male presents with respiratory distress, hypotension, subcutaneous emphysema and absent air entry on the right side. Next step is needle decompression in the fifth intercostal space. Question number 11. What is true about polyarthritis nodosa? Again, the features of the blood diseases are important. Polyarthritis nodosa again has its features. So 30% is associated with hepatitis B. And which type of aphasia is seen in lesions of posterior part of superior temporal gyrus? Again, parts of the brain and parts of the cerebrum are very important. Wernicke's area, Broca's area, and the gustatory area, every vision center, everything is very important, guys. Please go through the different areas and the numbers as well. And next one, a 70-year-old man man with diabetes mellitus and hypertension presents with dyspnea, elevated JVP, hepatomegaly, ascites and pedal edema. Diagnosis is heart failure, because these are features seen in right-sided heart failure. The features of left-sided heart failure also you need to know, guys. Questions can come up from there as well, just like this. Left-sided heart failure features can be given up and the question might be regarding that. So please go through that. Next one, slowing of conduction in multiple sclerosis is because of? Answer is loss of myelin sheath. Question 15. A 15-year-old girl presents with fatigue, chronic diarrhea, weight loss and iron deficiency anemia. Best test is IgA tissue transglutaminase antibody in order to check for celiac disease. Next question number 16. A 55-year-old male presents with tachypnea, confusion, blood sugar of 350, pH of 7.2, bicarbonate of 10 and PCO2 of 30. What is the primary metabolic abnormality? So again, acid-base disorders, how to calculate, very important. Here it is metabolic acidosis. Question number 17. A 10-year-old boy presents with fever, hand swelling and shrunken spleen. What is the diagnosis? Answer is sickle cell anemia, because hand swelling, dactylitis is a very important feature of sickle cell anemia. Again, autosplenectomy is a very important feature of sickle cell anemia. Question number 18. A 53-year-old woman develops leg swelling and pain after hip replacement surgery. Risk of pulmonary embolism based on Wells score. Again, it's a scoring and you need to go through it, guys. It's a PYQ, so you can't miss out on it. Learn the scoring. And here it is high because the Wells score is 7.5. What is the recommended water bath temperature for forcebright? Answer is 37 to 40 degrees Celsius. Question number 20. A mutation in the gene for aquaporin channel leads to? Answer is nephrogenic diabetes insipidus. Again, nephrogenic and neurogenic central diabetes insipidus are very important. The classification, the differences you need to know, and also there are other syndromes related to the diabetes insipidus, and you need to go through them as well, which is not a radiological finding in left heart failure, just like I told previously about right heart failure. Now the features of left heart failure is given, and one of them is focal oligemia, which is not a feature of left heart failure, and that becomes the answer here. It is seen in pulmonary embolism. Next question. A 60-year-old man presents with transient dizziness and loss of consciousness. Next step is ECG to rule out atrial fibrillation. Next question. A 12-year-old child with type 1 diabetes presents with confusion, drowsiness and Kussmaul's breathing. Blood glucose is 415, urine ketone is 4. Next step is ABG. Diabetic ketoacidosis management. Learn that chart, learn that table. It is very, very important. Now moving on to NEET PG 2019. A 65-year-old female presence comes to emergency department in state of unconsciousness. BP is 70/50. ECG shows narrow QRS, complex tachycardia and regular RR intervals and absent P waves. So what is the next step in management? Here it is pointing towards PSVT, and PSVT, what is the first step of management in unstable patient? Answer is DC cardioversion. And next question. Nasal polyps are commonly associated with? Answer is intrinsic asthma. It is seen in Samter's triad. Next, all of the following are AIDS defining illnesses, except again AIDS defining illnesses, very important guys. And here esophageal candidiasis is not a feature. Esophageal candidiasis is a feature, but oral candidiasis is not an AIDS defining illness. Question number 4. A 47-year-old man with AML and blood type O negative is being considered for allogenic stem cell transplant. Which donor is optimal? Answer is HLA identical 50-year-old brother with blood group of O positive. Next, 30-year-old HIV positive presents with fever, dry cough, weight loss, retrosternal chest pain, chest X-ray shows in diffuse interstitial infiltrates. Most likely diagnosis is pneumocystis jirovecii because it is commonly associated in HIV patients and in people with low CD4 counts, and diffuse interstitial infiltrates are also seen in that condition. All are true about GBS, except again GBS recently it has been coming up in exams. Even in NSET questions regarding GBS is coming up, so please read on that as well. Next, what is the best treatment for relapse of ITP? Answer is splenectomy because it is the treatment of choice for ITP relapse after first line treatment is done. Next, which cardiac chamber is enlarged in mitral stenosis on chest X-ray initially? Answer is left atrium. Which of the following is false about child-Turcotte Puke score? This question had previously come, and again child-Turcotte Puke scoring has come, very important. And the MELD scoring is used for liver transplantation and not the CTP score. Again, MELD scoring also you need to have an idea, and also there are certain other scorings in many other subjects. All the scorings are very, very important. Questions can come up and most of the students will be learning all these things, guys. You can't miss out on them. Next, which of the following is true about the bundle of Kent? Answer is it is faster than the AV nodal pathway. Question number 11. A 40-year-old male presents with weakness, paresthesia, breathing difficulty. ECG shows T-wave inversion and U-wave. U-waves are seen in hypokalemia. Osborne waves in ECG, again important question, seen in hypothermia. Next question, you also need to identify how an Osborne wave or J wave looks. Just Google it and find out. Very important, all these ECG is something very, very important. A lot of questions keep coming up from ECG, and don't miss out on it. Next, which hormone level is increased in obesity? Answer is insulin because obesity is associated with hyperinsulinemia and insulin resistance. Question number 14, diagnosis from ECG shows QRS complexes wide and absence of P wave and heart rate of 188 seen in ventricular tachycardia. Next, all are true about trigeminal neuralgia. Features of trigeminal neuralgia, please learn about that. And deep-seated pain is not seen in trigeminal neuralgia. In trigeminal neuralgia, there is superficial lancinating pain. Or features of Crohn's disease and ulcerative colitis, again that table very important, please go through that. Next, most common type of GBS recently questions are being coming up quite a lot, and please go through that. Next, Cushing ulcers are seen in answer head injury, and Curling's ulcer, where are it seen? Please check on that. Something again, a question can come up, something similar to the Cushing's ulcers, and please go through that as well. Now, what is true about paroxysmal nocturnal hemoglobinuria? There is deficiency of CD55 and CD59. All these CD55, all these CD counts are very important. Different diseases are associated with different CD counts and very important. Next, a patient with rheumatoid arthritis, even if you're preparing for NSET, the CD counts are very important, guys. And a patient with rheumatoid arthritis on methotrexate and corticosteroids has worsening disease. And what is the next step? Answer is add sulfasalazine and hydroxychloroquine because it is the seen in triple therapy for rheumatoid arthritis worsening patients. A lady presents with fever, oral ulcer and photosensitivity and a mala rash. Mala rash is seen in something very important which you learn from MBBS time itself. Mala rash is always associated with SLE. Next, which murmur increases on standing? So again, murmurs, there's a table. Which murmur increases on standing, which murmur increases on squatting, which murmur increases on Valsalva. All this you need to have an idea. Questions keep repeating, and even in NEET PG 2024 question was there. So please go through this. Next, reduction in FEV1 by FVC, again features of obstructive lung disease and restrictive lung disease, and that graph is very, very important. Please go through that. And also management of bronchial asthma is also very important. COPD management, please go through all that. And ventricular tachycardia, ventricular fibrillation, PSVT, all these managements are also very important. Please go through that. And WPW syndrome, all this digoxin toxicity management, all these are very, very important topics in medicine. Please go through all that because ECG and heart related conditions, a lot of questions will be coming up. You can't miss out on them. Please check all that. Calcitonin levels are increased in answer hyperparathyroidism. And next question, which does not lead to ARDS at blood lung interface? Answer is pneumonia because pneumonia causes ARDS at the air lung interface. NEET PG 2018, thrombosis of the posterior inferior cerebellar artery causes. Answer is lateral medullary syndrome. Also, please check out on the medial medullary syndrome and the medial and lateral pontine syndrome as well. It is a little difficult topic, but please go through that. Questions keep coming up from there sometimes. If at all question comes, don't have that chance to miss out on them. Please try to read them also, but read these topics with much concentration because it is little confusing and you need to remember them. Next, a patient presents with frequent urination, nocturia and enuresis. 24-hour urine volume is 7 liters, urine osmolality is 260, ADH is 0.8, MRI shows absence of pituitary bright spot. That is a very important sentence. Absence of pituitary bright spot points towards pituitary diabetes insipidus. Next, what levels of prolactin are definitely suggestive of prolactinoma? Answer is more than 200. Next, a patient develops prosthetic valve endocarditis 2 years after valve replacement surgery. Which organism is responsible? Answer is streptococci. Next, most common extra-articular manifestation of rheumatoid arthritis. Answer is subcutaneous nodule. Again, the Jones criteria and all this about related topics of rheumatoid arthritis is very important. And rheumatoid acute rheumatic fever Jones criteria is also very important, and rheumatoid arthritis features are also very important, guys. Rheumatoid arthritis are the most common features like the subcutaneous nodules and its association with other conditions like Sjogren syndrome are also very important. Next, periodic acid and also certain manifestations which are seen in rheumatoid arthritis like the Swan-neck deformity and all are very important. And next, periodic acid shift positive macrophages are seen in. Answer is Whipple's disease. It is caused by Trophorima whipplei. And next, according to Berlin's definition, moderate ARDS is characterized by all except. You need to learn about this Berlin's definition as well because questions come up from there as well. Next, low serum copper levels attributed to ATP7A gene are due to. Answer is Menkes disease. ATP7A is associated with Menkes and ATP7B is associated with a very common disease. Yeah, please do check out on it. I'm telling you the answer. It is Wilson's disease, but please learn about the features of these disease and the management and other important things and the KF rings which are seen in Wilson's. Please go through all of that. Next, a patient presents with cutaneous vasculitis, glomerulonephritis and peripheral neuropathy. Which investigation should be performed next? Answer is ANCA. So P ANCA, C ANCA, seen in different conditions. You need to be knowing their names, and also HSP is very important. Please read about that. And what is the approximate time interval between HIV infection and the manifestation of AIDS? Answer is it is commonly 10 years. Next, myasthenia gravis is associated with. Answer is decreased synaptic transmission at myoneural junction. Previously also there was a question on myasthenia gravis. It's a very important topic. Even from pharmac level, myasthenia gravis is very important, and medicine also myasthenia is very important. So please check out, please read more about this area. Next, which of the following is incorrect regarding Weber's syndrome? Answer is ipsilateral paralysis of lower face. Next one, a 10-year-old boy complains of multiple episodes of acute severe pain in his fingers and toes. Most likely diagnosis is, since severe pain in fingers and toes points to dactylitis, most likely answer here is sickle cell anemia. Next, cryoglobulinemia is associated with. Answer hepatitis C. What is the characteristic pattern seen in Brown-Sequard syndrome? Answer is contralateral, loss of pain sensation, and there will be ipsilateral motor weakness. Next, a child presents with hepatitis, progressive neurological degeneration and KF rings. KF rings very important, seen in Wilson's disease. And what is the initial diagnostic step is the question. So answer is serum ceruloplasmin level. So you need to have, since questions keep coming up one step forward, you need to have more idea about, rather than knowing just about the features or the names of the disease, you need to know about the diagnostic criteria and about the and the management and other important things as well. Of every topic, which is a PYT. Next, automatic implantable cardioverter defibrillator implantation is indicated in which condition? So it is implicated in all of the above conditions. Next, pseudo-P pulmonale is seen in which electrolyte abnormality? Answer is hypokalemia. Now the Gold's criteria for COPD, very important, and here the answer is for very severe COPD, it is FEV1 by FVC less than 0.7 and FEV1 less than 30%. Next, a 35-year-old female has hypokalemia, hypotension and metabolic alkalosis. Most likely etiology is Liddle syndrome. So there are certain syndromes like Liddle syndrome and other syndromes. Please, Fanconi syndrome and many other syndromes are there. Please go through that and the different features seen in all of them. Next one, what is the diagnostic test of choice for HIV in a baby born to an HIV infected mother? Answer is HIV DNA PCR. Next question, which of the following is not a common feature of allergic bronchopulmonary aspergillosis? Answer is distal bronchiectasis, because in ABPA there is central bronchiectasis. Next, a 58-year-old male with hypertension and no organ damage should be started on pharmacological management if BP is more than 160/100. Middle-aged woman with Graves will have which thyroid function test result? Answer is low TSH. Observe myocardial stunning pattern does not match the ECG findings. What is the probable diagnosis? So, Takotsubo cardiomyopathy, most of the times the ECG pattern will be normal, but there will be the heart, since there is sudden stress, the heart will be forming up into a Takotsubo, that is the Chinese octopus catching instrument. Now, which antiretroviral drug is not used in HIV and hepatitis B co-infection? Again, this is a pharmac-related question, and the drugs for most of the common conditions need to be dihydrated. The drug of choice is very, very important, and even for certain infections, you need to be knowing which are the common drugs and which are the common investigations, the first line and the gold standard. All of these should be known, and the drug of choice is also very important. So here the answer is abacavir. It is not used against hepatitis B and HIV co-infection. Who comes under category 3 in non-heart beating donors? Again, there's a classification about the non-heart beating donors. Please go through that. Here it is, a patient who is awaiting death in the hospital. Next question, which condition is associated with AV block? Answer is hypothyroidism. Question number 29, which drug is used for mass chemoprophylaxis for meningococcal meningitis? Answer is ciprofloxacin. So that's it, guys. I have compiled 2018 to 2023 in this video, and 2024 I'll be uploading separately in another video. So that's it, guys. Till I come back with my new video, stay tuned. Till then, bye bye.